think key points as you're doing your ABC assessment is that oxygen saturation is only one aspect of your respiratory assessment. And in fact, it may be misleading and not reflect ventilation or CO2 exchange. Use your heart rate as a monitor. Use the level of consciousness as a good index. Think about positioning. How does that help or hurt someone's respiratory mechanics? Is this someone who's better sitting upright, side lying, prone? What does any procedure that they may have had have implications for that? Acutely, you might also want to consider holding the enteral feeds. So if they have an NG tube or they're getting gastrostomy feeds or other post-pyloric feeds, that you may actually want to hold those feeds until you determine what the trajectory is. What you don't want to do is compound issues by placing them at risk for vomiting and aspiration. Non-invasive measures, as you think about types of respiratory supports that you can provide them, have risks and benefits. And if not implemented properly and reassessed, they may actually potentiate the problems. If you place a bag and mask on someone's face, you can actually, if not done properly, create some airway obstruction. Giving too much pressure or recognizing that you're not completely inflating the chest, you may be actually contributing to impaired mechanics and lead to gastric distension, which decreases FRC, but also increases your risk of aspiration. And so you need to be cautious and thoughtful about any interventions that you do. Call for help. Low threshold. You're in the hospital. The nurses called you for help. Clearly, there's some sort of distress, and you should rely on your senior residents. You can call the intensive care unit fellow. You could hit the code blue if you are truly, truly concerned. Call for help. Low threshold. But use the family as a potential barometer. They're often very good in terms of calibrating you and everyone around you as to what their child's baseline need is. They may say, oh, in fact, he's always breathing this quickly. Or, oh, she typically does this after she's gotten a medication if we just wait. Or they may say, in fact, actually, this isn't right. So use the bedside provider to help calibrate yourself, whether it's the nursing staff, the respiratory therapist, the parents, or simply call for help if people are uncertain.